Good morning, Steve Stites, Chief Medical Officer at the University of Kansas Health System. I'm here in our studio with the Dolph Simons family studio here at our hospital, and wanted to welcome everybody back on this wonderful Monday morning. We're back to talk about all things coronavirus. Today I'm joined in the studio by Chris Brown. Chris has been on our program before. He's one of our outstanding hospitalists. And by Ashleigh Adams, those excellent nurses. Ashleigh's been involved in the care of patients with COVID up on the unit. Chris has also done that. And also in Studio B is Courtney Ash. Courtney is the Director of Respiratory Therapy here. You know, respiratory therapy is one of those unsung heroes because of the pandemic. You know, they're on the front line a lot of times doing breathing treatments, et cetera, with patients who have COVID-19. And then we also have one of our chaplains, Kathy Riegelman, is on Zoom with us, or Skype. And Kathy, welcome. We're glad you're here. And someplace out in Colorado is Hawkeye, once again on the road and looking like there's a beautiful backdrop behind him. So we're going to start with you, Hawk. How do things look out there, either in Colorado, or how do they look here at KU, more importantly?
Yeah, again, when we were in Colorado this past week, there's a very good mask culture. So currently, I'm out west on the backside of the Rockies, and you know, we can't even go into stores or restaurants without a mask, and they have hand sanitizer pump out front for everybody to go into. So it's a really different culture out here, which is a good thing. There is certainly an overabundance of caution. As far as in the hospital, you know, I was still waiting for the numbers, unfortunately, for today, but I know that as of this weekend, we'd had at least in the low 20s, 21, 22 people in the hospital. There were at least 8 people in the ICU with 6 patients on the ventilator. So, you know, our numbers seem to have increased a little bit and ticked up a little bit from the last 10 days to 2 weeks.
Yeah, we were there around 9, 10, 11, and now we're in that 2022 range. And I suspect with societal reopening, that's what's going to happen. Kathy, you have a very different slant, I think, on what's going on around COVID-19 because of your work here. Talk to us a little bit about that.
Well, there's been a lot that we've learned as we've gone through this time. And a lot of it has to do with really being flexible, being able to be proactive in connecting with those families that couldn't be at the hospital. And that's continuing in its own way because we still have some visitor restrictions. What we've learned is that how we connect with human beings, either through human touch or through just a verbal conversation, has been really different. And it's really pushed us to be flexible in different ways in how we connect with people.
That is really important. So Chris, how has it been up on our floors taking care of patients with COVID-19?
I completely agree. It's hospital, just medicine in general, is really just transformed. How I communicate with nurses, how nurses are able to communicate with family members, and how we've had to involve, whether it be pastoral care or our palliative care department, it's transitioned just a lot from that, just in communication across the board.
Yeah. Give me an example of that.
So I think, most importantly, I think we had a situation at one point where early on, palliative care reached out, several of them said, how could we get involved earlier than later? Because we saw that these patients initially back in March and April, when they come in, within 12, 24 hours, they could go from being on the floor having conversations, how we're having conversations, to immediately being transferred to the ICU. Whereas a lot of times previously, families could be there, we could kind of moderate a lot of those things and educate them as we were doing certain things with that family member. And we had to spend a lot of time to create, whether it be with Skype, via Zoom, and had to spend a lot of time where we would be physically in the room, which you've had to do before, with family members and multiple family members, palliative care, helping, leading that charge and explaining things. So it's created a lot of different ways. We have to be creative in how we involve families and involve patients and connecting them. And we had to spend quite a lot of bit of time at the bedside. And that's why a lot of times early on, I would always kind of give them their props, because they were truly at the bedside an awful lot.
You were at the bedside a lot and having to spend time because you had to be both family member and nurse, Ashley. Talk to us a little bit about that.
Well, during that, the Zoom meetings were amazing. I feel like that helped because at first, when COVID started and families couldn't come, we weren't sure. I mean, it was all phone communication. So
Right.
people are like, I want to see my family. And so you're being that person, like having to explain what this team came in and said and what this team member came and said because the family's not at the bedside like they used to be. So being that person for them was very difficult at first because it was a new role in a way. But I mean, I feel like our communication has just gone up so much. It's so
Yeah.
much better. Everything's better. We have definitely like worked as a team with everyone.
It is
and
amazing.
Palliative coming and teaching us how to do the Zoom meetings and setting that up for us to where we could just do it ourselves eventually and have
Yeah.
family come and like, okay, let's set this up. And we'd set up times with family members and do it. It was really great.
And
It's
are
really
we
great.
still doing that?
We are.
Yeah.
We are. If they ask, because there's still some family members that are still being very cautious, which is good. Which is
They
very
should be
good.
cautious,
And they should be.
absolutely.
They should be. So
COVID's real.
it is very
So
real.
now that we have one visitor, has that helped a lot? And how is that?
In some way, it's been kind of different. Like, I know the rules are always changing, and so we're trying to change with it. You know, they would come up and then getting people used to the process now. Like, I've gotten to work with the front door now.
Yeah.
So I got to see a couple different roles, and that is very different. People are very, like, I just want to go in and see my family. I'm like, no, we have steps now. We have to take your temperature, and we have to have you check in, and
Right.
all of that. So it's been a transition for everyone. But
It
it's
is a lot
still
different.
It's good. I think people are relieved getting to see their family members.
Courtney, how has it been as in the world of respiratory therapy? Because clearly when it comes to exposures, respiratory therapists are going to be one of the highest groups in getting a lot of patients with COVID.
You said it's nice to have some of the visitors back in the hospital, the therapists, and I know the nurses and many other caregivers felt like the patients need that connection to their loved one. And so the therapists and the nurses were trying to provide that. I think a lot of these patients are so sick and they're here for much longer than what our typical patients are. And so not only is it mentally taxing, but it's physically taxing to take care of some of these patients. And I think we're just all in it together.
How's your team holding up?
I think they're very proud, and I'm very proud of them. We have not had a single person who has been scared to work with patients that have COVID. We feel very confident in the PPE that the hospital has. We're very grateful for a really great team that we're a part of. I think it's scary, and they're scared of getting it, and they're scared of taking it to their family members, but they're also very confident that they're protected, and most importantly, they're doing the right thing for the patient.
Yeah, it's a big deal. Hawkeye, over the weekend, some controversy arose over the steroid paper, whether or not with Decadron, early use, and it was actually a very valid methodology. People could be changed in and out on one arm of the study to another, and now all of a sudden we thought, okay, Decadron's cool, and now we're saying, oh, wait a minute, is this going to be one of those papers that has to be retracted later? So, thoughts about that?
You know, I think this has just been consistent with how the medical literature and the trials have gone and the data presentation throughout COVID. I still think there is benefit of steroids. We have a long list of beneficial conditions that we treat steroids with. Again, I think it's going to be about the timing and the dose. But I think certainly, some dose of steroid at some point in time during your illness, if you have COVID-19, is probably going to have some beneficial effects. I think we just have to continue to watch the literature and really see what plays out with this.
You know, it's interesting. Things are being published, to your point now, that would never have been published in the normal era. I reread the remdesivir paper this weekend, and as I sat there looking at it, I thought, you know, this is a really small study with very poor controls. There is no way on a normal basis this paper makes it into the New England Journal of Medicine. It would have made it into a second or third tier journal at best. And now, because we're so desperate for therapy, things are looking, we're trying to do that. Second comment, Dana, as you look at the emergence of the growth in many areas, Alabama, even here in Kansas, Missouri, we're seeing hotspots being the same story. Bars, gatherings, church, things of that nature. Nursing homes appear to still be behind kind of these big spreading events. Thoughts about that? What does that mean?
Yeah, if we just look at total numbers of infections, we know that there is a very small number of infections in the United States compared to the population of the United States. We know that when there are susceptible hosts, they will get infected. And I think this is just evidence of that. When you have people that are in confined areas together, this virus we have shown and we have seen that it spreads very easily. It didn't take long, again, for it to jump to different countries and across the oceans. This is just on par with the course of what we've seen the last few months. If you have large gatherings, if you have people not practicing the public health guidance of physical distancing, masks, and hand hygiene, we know that the virus is spread, and that's what we are continuing to see. And we shouldn't be surprised to see that. And I don't think there's really going to be a slowdown until there is a more adequate treatment, but also a vaccination. I think looking for herd immunity when we really need 80 to 90% of people infected, I think that is going to take a lot of toll on the United States as far as healthcare rooms, drugs, PPE, all of that thing, not to mention the morbidity and the unfortunate lives lost.
Yeah, I think that's exactly right. And it's interesting because you see some of this antibody testing now in like the football teams or this and that, and it looks like the prevalence is going to end up being around 3 to 4% of patients have had COVID-19 out in the public. If that's really true, my math says that's 96 or 97% of the public has not had it. We're nowhere near herd immunity. All right, Jill, what questions are rolling in this morning?
Well, from the public, we have Jay who wants to know, why is the Missouri death rate substantially higher than the Kansas per positive COVID cases?
Yeah, so Dana, that's a great question. And I've spent a little bit of time looking at the Missouri versus Kansas data. Why is it? And then let's use that to even talk a little bit for a moment about why the death rate has dropped here in the hospital. You first.
Yeah, we've had some conversations about this. I think there is probably a lot to do with the initial infections. I think, certainly St. Louis County in that area, I think we are still continuing to really look at, number one, the populations that were initially infected, possibly the congregate living like the nursing home. And then number two, I think it does continue to go back to the health disparities, especially in the minority group. And I think that is probably largely what has driven it when you're looking at Missouri versus Kansas. We have been very fortunate, I think, in Kansas in the fact that the large clusters, especially in the prison, but also in the food packing plants, we haven't seen a lot of hospitalizations nor death from those.
Yeah, I think that's probably the whole story, really, is who's getting infected. What we know nationally is that the number and the percentage positive is going up significantly, but the number of people dying is going down. Chris, have your therapy approach to treatment changed since the beginning of COVID-19? Are you doing things a little differently than you did initially?
Oh, yeah, I've seen it quite a bit change.
Talk to us about some of the differences that are going on.
So, from an inpatient standpoint, obviously, the wonderful drug hydroxychloroquine.
Yeah.
And azithromycin, all of those things were the initial things that we were seeing. I see Dana smiling.
He's going like this.
Yeah, I know. But that's what we were doing. And again, a lot of that came about, resources too.
Yeah.
The big thing. And then we slowly started modifying things, thinking about, okay, what are the mechanisms? What are some of the inflammatory aspects that go along with the process? Cytokine storms. And so we've slowly just kind of gone from the not tacrolimus, but the tocilizumab, and it was still around a little bit. Convalescent plasma and all of those things.
Anticoagulation.
Yep, anticoagulation, all of those things. So I've seen a drastic difference in just the different treatment modalities that we've begun to utilize. And I think initially, at least my personal opinion, the initial thought process, and I've even talked to some pulmonary staff, we were just trying to figure out how do we take care of the ICU. How do we get them off of the vent? Then we went to, okay, how do we keep them off the vent?
Yeah.
How do we
That's a much better strategy.
Exactly. Yeah. So we really had to change quite a bit. But I think, again, you mentioned the New England Journal of Medicine article, Remdesivir. In America, we really do have to think about how we set these protocols up. You know, we have to think about risk benefit analysis. We have to think about all the side effects that go along with some of these things, the legal aspects that go with some of these things. So it's changed quite a lot.
Well, I'm hoping that it's mask wearing and good hygiene means even if you get it, you have less intensity of exposure. So Ashleigh, when you go out in public, do you wear a mask?
I do.
Oh, that's a good thing. That's the right answer to give. So do you feel uncomfortable when you see others without a mask?
Not necessarily. I try to educate. I know that's not. I don't
No,
go around
that
just
is
preaching
the
to
right
people,
thing
but
to do. No, please.
yeah, you know, I was at the grocery store and there's a guy behind me, and I have 3 stepdaughters, and we're sitting there, and then he doesn't have a mask on. He's like, "Oh, if I get it, I get it." I'm like, "Okay, my kids are right here," you know.
Yeah.
So I just kind of like, you guys go ahead and go forward. You know, some people you just try to educate, but they don't.
Yeah.
I don't want to say they don't care to learn, but some
You know, I
people
was
just
surprised.
don't think it's a real thing still.
I'll be honest, I was surprised that my kids and I went out on a bike trip this weekend on the Katy Trail, and there was a little restaurant there, and we were a little hungry and thirsty, so we stopped, and I make a rule not to eat at a restaurant right now. I'll do takeout, but I won't go into a restaurant. So there was outside tables, but the people inside the kitchen didn't have masks on, and I was like, you have got to be kidding me. How can you not have a mask on right now? That just doesn't feel good. And Courtney, I bet your respiratory therapists, they know to wear masks all the time, right?
Know to wear masks. We have been very great at wearing masks, and like Ashleigh said, when we go out in public, we're all masked up. Even I have small children myself, and they're very good about putting their masks on before we get anywhere.
Chaplain, you know, there's got to be some spiritual thing here. I don't quite get it. Why is it in Colorado people will wear masks and in Kansas and Missouri we won't? Talk to us a little bit about that, and people politicize masks. What's your sense as a person of faith? How do you approach that discussion?
Well, I think we try to bring it back to just the facts that you all are talking about, and realizing that there really isn't any magic protection if you're a person of faith. This is a virus that doesn't make distinctions in that way. And honestly, I don't think we've had, at least my conversations around the hospital, there hasn't been much that has touched on kind of those spiritual aspects of like God protecting me or anything like that. It's been more conversation about how do we stay safe so that we can keep serving. But I understand what you're saying. It's gotten to be more than a safety issue. People are using the mask to make statements of different kinds. And we really try hard as chaplains not to get out of that neutral territory, because those can become pretty, you can get yourself in trouble pretty quickly if it turns into a political conversation. And that's not really why we're there. So from a spiritual perspective, we just want everyone to be safe. We know that those church gatherings, like in Kansas City, Kansas, where people, you know, before we really knew the impact of COVID, that, you know, some people got really sick. And so many of the churches, I think, are continuing to do online worship. And the ones that have opened, you know, again, we're just hoping that they're honoring all of those wonderful safety issues of physical distancing, masking, limiting the number of people that are there. People want to be out and be amongst people, and especially be in their places of worship, but it has to be done safely.
Yeah. Jill, what do we got?
Lots of questions. Laura wants to know, she has a family wedding that's out of town in September, requiring that they fly. They postponed the big wedding. Now they're going to make a smaller one. She still doesn't feel comfortable. She's wanting to know, how do I tell my family, I love you, but I don't feel comfortable getting on a plane coming to your wedding?
Well, Dana, first of all, let's you and I tackle the wedding question before we punt the existential question over to the chaplain here. I am not Patrick Mahomes on this one, folks. All right, Dana, you know, you've been flying a little bit. I haven't flown. I'm still driving. I mean, flying, I don't know. I guess you have to sometimes.
Yeah, I think flying is going to get more and more complicated and possibly more anxiety-inducing. Certainly when I flew, that was a couple weeks ago, there weren't that many people in the airport. The planes were not fully filled.
Some hand sanitizer.
I have a friend who flew last week, and the airports were more filled. There weren't that many people wearing masks, you know, maybe 50% or less. The airplanes, may be getting more filled. So I think as we move in further through time, that the airports are going to become more packed, more filled, with more people in line waiting for TSA and things of that nature. The airplanes themselves are probably going to be more filled, and so I think it's probably going to be, certainly increased risk as we move further, unless something changes.
Yeah, and I would say to someone, it's hard to travel, but if you have to travel with kids especially, it's just going to be more difficult, and flying is hard. So I'll turn now to our chaplain, Kathy Riegelman. Kathy, what are your thoughts about that?
That's been a question that's come up over and over, and I've heard about so many rites of passage that have been postponed, as we know, weddings and even funerals or memorial services that are having to be postponed. Just one of the theological beliefs that I hold deeply and has been kind of a guiding point in my own ministry is that love will reach someone, that distance doesn't diminish love. And so whether you're at the bedside, as in the case of being with patients, whether you're in the group of guests at a wedding, or whether you're in your home, maybe watching a live stream of that event, the love that you feel, the love that you express is going to find its place to the people that you love. And that's what I've tried to stress over and over with people. I've actually done a couple of weddings. I've officiated a few weddings recently. One was a large wedding that got really downscaled to just immediate family. And what we found was that the efforts that people made to keep that connection, either through the live streaming, through the responses that came with that, through a video that was created for the couple, those extra efforts mean so much right now, and people are being creative and finding ways to make sure that that love that they're expressing, that care and compassion is reaching those that they love. I think we have to continue being creative. There's a lot of flexibility and creativity going on out there that wouldn't have happened if it hadn't been for this.
I think that's really true. Okay, two quick stories. One of my best friends, Bill, and I like to go fly fishing together and tromp around the Mark Twain National Forest. His son got married, and they had to downsize that wedding and change the dates a few times and got really small. At the end, the family was like, you know what, that was actually really good. It was so intimate and so personal. So there'd be something to gain. Number two, your point about love. Love does endure, and I do think it crosses boundaries pretty well. And it's pre-COVID. Love was out there even before COVID. I know it's hard to believe that. But but my kids, my daughter graduated from college at the same time as my son, who graduated from high school. My son was here in Kansas City. My daughter was about 1,500 miles away, and there was no way to do both. So we had to split and divide as a family. And we had to. So I got to live stream his graduation, and a lot of my family live streamed my daughter's graduation up in Vermont, where I was. You know what? My kids still love me, and we've had a great time, and that's made for a great story. So it's different, but it can still be good. Jill.
Ross says that a lot of people, specifically young people, still don't believe that COVID is around and that it's bad. He's worried they're going to spread the virus. How does he help educate?
Yeah, how does he help? Okay, Courtney, you got a lot of young people in that department of yours over there in respiratory therapy. How do we convince them? Yeah, I mean, they're convinced they're wearing masks. I mean, they know if they have to, but I hope they're doing that in public. Why? How is that? Well, what do you think the educational piece? And don't worry, Ashleigh, you're not off the hook. I'm coming after you next.
Okay, well, yeah, we do have a lot of young people in our department, and I just think you have to lead by example. So you have to acknowledge that the disease is real, and what you can do to help prevent the spread is wear the mask and wash your hands. And yes, it might not be as detrimental if you get the disease, but you then would be spreading the disease. So it's important for you to be an example, a leader, wear the mask, wash your hands, keep other people safe.
Okay, Ashleigh, I'm now going to commit a cardinal sin. You ready for this?
I'm ready.
Okay, how old are you?
33.
That's young to me because I'm 60.
You just busted out my age.
I did bust your age. I told you I was going to commit a cardinal sin. Chaplain, you're going to have to forgive me after the program and make sure that I stay out of trouble.
Say, come here, Mary.
Yeah. But Ashleigh, so talk to me about how do young people respond to this? Because I look at the folks not wearing masks and I'm like, really? Really?
Yeah.
What are you thinking?
Yeah, you know what, having kids, teens, and things like that of that age, I was surprised. Mine were on board. Once we talked to them about, you could possibly give this to grandma or grandpa and you want them to be around, then it just clicked once they understood, like,
Right.
it's not just about you, it's about others. So I completely agree with your statement about that. It's about everybody. We all got to be in it together.
And I think that's it, right? It's not just about you. Okay, another story for today. My mother-in-law was out on the porch one time. We were talking about what we're going to do for kids and not to go with kids growing luck, and I had all my opinions and this and that. And my mother-in-law looked at me and she goes, well, you know, Stephen, it's not about you. It's about your kids. I was like, dang. What do you say to that? What do you say, Brad? I think you just hung on that.
Well, I mean, my father used to tell me a hard head makes a soft behind. So, you know, it's one of those situations where, unfortunately, you know, my experience being there, seeing these patients super, super sick, like Ashleigh, Dana, you know, it's just about just reinforcing, it's about education. You know, it's really about just sometimes begging, please just do it. Yeah. You know, it's better for you in the end. You know, you don't want to be that young person who is there and you see it in their eyes like, okay, why me? None of my other friends, they're all asymptomatic, you know? You know, we think about the clusters, rightfully so. We understand that a lot of the most morbidity and mortality comes out of those clusters, rightfully so. But we still do have a lot of young people who, when they get sick, they still get sick.
Right. Yeah, I was telling a story, and this will be a quick one to come back to you, Jill, but I was down in the Ozarks and again down in the forest, and was with a guy and he owned this place called River Life Farms. A good man, Myron McKee, and he said, "How's it going up there in Kansas City?" I said, "Myron's actually, you know, we're things a little better, and of course now it's a little worse, but things are a little better." And I said, "I'm not seeing as much mask wearing down here." And he says, "Well, you know, we're a distance, it's all spread out and all that." And I said, "You know, Myron, all these young people that have come down here and all that, they go floating and they're in the river and all. You got to encourage them to wear a mask." He said, "Well, young people don't really get this so bad." I said, "Yeah, we'll tell that to the 29-year-old who just died of a KU. Well, did they have other underlying medical? Yeah, okay. Well, tell that to the 25-year-old. Yeah. Well, what was wrong with them?" I said, "The only thing wrong with them is they got COVID."
Yeah.
It is real, and it's real in every age group. Jill.
Marcy wants to know, when are you going to have antibody testing for healthcare workers in the community, for everybody?
Oh boy, here it comes, Dana. Antibody testing. We just got it as of this morning. Talk to us a little bit about that.
Yeah, I think we put out a communication to our employees that we have now validated a test that's really going to be sensitive, specific. It's going to really, you know, the important thing we've been talking about here is statistics, and the fact that if we test you and it's positive, you really have had the antibody, and if it's not, or you've had the infection, so you've produced the antibody, and if it's not, then you haven't had it. The one thing to remember, again, is we think the antibody test, the antibody production that your body makes, is going to give you some immunity, at least for the short term, 3, 6, 9 months maybe. But it's not a specific marker of immunity. We still don't understand exactly what having antibody means. Are you going to be fully protected from the infection, or are you going to just get some mild disease or symptoms? And now there's some new information coming out as well that even people who maybe we were talking about have had asymptomatic disease or mild disease, they can mount an antibody response, but it doesn't seem that antibody response is as robust as people who've had more of a moderate to severe disease. So there's a lot of questions going into the antibody function and what it really means inside your body. But to quick answer that question, just as you said, we have kind of started to go live today with it in our health system for testing for antibodies.
This, that you established the role of it, but we're going to start getting more data. I think that data is going to help us understand it. And I believe other places, based on our CMO call last week, are also getting antibody testing. I think everybody's starting to get them about the same time. And so I think it's going to be something you can get. Now we just got to figure out what it means a little bit more. Chinese paper over the weekend came out and said antibodies may not last very long. We need to go study that here in the U.S. because we're seeing a lot of differences in how the disease has acted there and here.
I think Allie has done the same reading over the weekend as you, and she has a good follow-up question. Knowing what we know about antibody testing, is that going to hurt our chances for a vaccine? If it doesn't...
Yeah, I think the antibody testing and the vaccination can look a little differently as questions. And Dana, you can probably help me with this a little bit. But The antibody testing, if it begins to fade, what we do with vaccination is you'd get a shot, and then you may have to get a booster shot 6 or 8 weeks later. And that second booster tends to really keep your antibodies at a lot higher level.
Yeah, absolutely. A booster shot, like you said, or even like influenza, are we going to need something yearly? We know that with common coronaviruses, people can get infected with the same common coronaviruses 9 months or a year later. So we understand that can happen. We also need to make sure that, again, antibodies are not the end-all be-all of our immunity against coronavirus. We also need to have our cellular immunity, our T cells and B cells, to help with fighting off the infection as well. So there is some positive things in the antibodies and antibody testings, but it is not the whole picture when we're talking about our immunity or testing itself. And I don't believe that it will really change otherwise how the vaccines are moving forward. There is still going to be a lot of resources, a lot of clinical trials going along to try and create vaccines, either one or a number of different ones.
Lindsay wants to know, if someone in the family decides to go to the gym regularly, she has two-part question. Should they take off their clothes, immediately go do a shower when they return? The second part is, should they even be going if they have a 60 or 70-year-old parent?
All right, gyms, here we go, Dana. I like to go to a gym. I tend to work out pretty frequently. I know it shows so powerful as I have such strong biceps, but you know, I go and we only work out outdoors. We don't go indoors, and I think that's a big difference. Dana, what are you thinking?
You know, my friend there, Chris, we go to the same gym. You know, he lifts a lot more weight than me, runs a lot faster than me, but he's a lot younger too. We have debated this through text message. We would like to get back to the gym. Do we feel it's a safe place? Again, the main thing is I think exercising outdoors is going to be good, but gyms typically are more confined spaces. Wear a mask if you can. Obviously, if you are doing an elliptical or a treadmill, that's going to be hard to wear a mask. As it gets warmer, the gyms are also going to be warmer because even the air conditioning doesn't necessarily work too well in the summer. So you're going to be sweating as you're doing exercises, stretching, lifting, things of that nature. I think it's going to be dangerous. I still have not ventured back to the gym, but when I do, I will definitely be wearing a mask as much as possible. I'll probably bring my own hand sanitizer, and I will try to stay as far away from others as well, physically distancing. But if you do go to the gym, no, I think it's just like work in the hospital. I don't think you necessarily need to immediately come home, take off your clothes, take a shower, do anything like that. Again, the hand hygiene is going to be most important. If you can do that, I think you're going to stay safe.
Well, I think that's it. I think it's about the hand hygiene and people wearing a mask, Chris. Thoughts? Because it sounds like you go to the gym with Dana. My apologies.
Well, I think it's it really is a difficult question to answer. I'm just going to be honest. Because, as you know, outside, a lot safer. But when you really start lifting, when you get on that treadmill, when you start doing all that HIIT training that people like to do, it's kind of difficult.
Well, you're breathing hard.
Exactly.
You're
sweating.
Yeah.
And as you know, those masks, I mean, once they become sore,
right,
they're no good anyway.
Right.
So I just think it really does come down to be self-awareness. You know, it's going to potentially come with some risk. Try to utilize machinery where there's not a large congregation, etc. A lot of the gyms are now taking things out, purposely separating, trying to create a 6 feet distance. They're trying to change times around in which they can clean. But it's really going to be a personal.
Yeah, and I think it's a personal decision. We've said this a lot. It's about really personal risk, right?
Yeah.
How much risk are you willing to take on? If you're willing to take on a little bit more risk, go there. But beware, you are taking on more risk.
Yes.
There are some other things you can do. Some gyms are going by appointment, so they control the number of people that are in there at any one time. You can be there for a half hour, 45 minutes to an hour.
Yes.
And that way you can kind of spread yourself out. Wipe the stuff down before you touch it. I know somebody's supposed to be wiping it, or else wipe your hands after every time.
Exactly.
And then don't touch your face. Oh, wait, these are the same pillars of infection control we talk about every day.
Right.
Why? Don't touch your face. Wash your hands or use the alcohol sanitizer. Wear a mask. Keep your distance. Don't touch your face and cough into your elbow. Ashleigh, do you work out?
I do.
And where do you go? No, I shouldn't ask that question. Ashleigh, have you gone back to the gym?
I have once.
And how was it?
They did a really good job of, like, every other machine's marked off. You can't get onto it. It's harder in the weight area because it's all
Right.
together. You know, that's where
Yeah.
everybody is. But I feel like people themselves have been pretty good about, okay,
Trying
you're
to do
using this,
that.
so I'm going to go over here, or
Yeah.
utilizing all
Staying
of the space
away.
of the gym.
Staying away.
Yeah.
That's it. Okay.
Robin says, if I got takeout at a restaurant recently that was closed due to COVID, should I be worried? What should my behavior be? What should I be doing?
So, I think the restaurants, if you're getting takeout, there was a while we were all worried there about a couple of things. Mostly we're going to wipe down everything, including wiping down the fried chicken. That was not very good, by the way. But what we've learned is that it doesn't seem to live on food. It doesn't seem to live on containers as much. So I'm less concerned about that. Where I get most concerned is whether or not people in preparing the meals are going to have masks on and whether they're going to come out. And I am just befuddled that people think they can prepare food, hover over your food, grab it, put it in a container, and then not wear a mask. Now, granted, I'm a little hypocritical there because I just said I don't think it lives very long on food. But Dana, still, not wearing a mask during food preparation, that ought to be like elementary, my dear.
Yeah, I mean, that seems a little backward at this point. We would certainly encourage anybody who's in that confined space of a kitchen, whether it's a fast food or a restaurant, to be wearing a mask and doing those things. And again, once you're getting takeout, if you can do the things that we have talked about, once you get it home, make sure you prepare, set it out, take it out of the packages. And the last thing you really want to do is wash your hands right before you eat. I think doing those types of things, you are going to really reduce the chance of you getting COVID. But I don't see a very high risk from that situation. Again, I don't know the exact situation of that restaurant and who it was, if it was employees and clients or whoever. But I think if we do those things, you're really going to make sure that your risk is as low as possible.
Courtney, you're a respiratory therapist, right? I can't imagine. Talk to me a little bit about, would you, as a respiratory therapist, stand over something and not have a mask on that you're going to be given to somebody else?
No. I just think what you said, it's elementary. If you're really thinking about others and thinking about keeping everybody safe and yourself safe, you want to make sure you have a mask on.
Anne wants to know, what is the best mask for my elderly mother who has COPD and is on oxygen?
Oh, boy. I tell you, that's a hard one, Dana. The elderly, and Courtney, let's come to you with this question. An elderly patient with COPD wearing oxygen, there are a few people for a mask in whom that's going to be pretty uncomfortable. What do you think?
Yeah, I would agree that they would just need to do their best to try to wear the oxygen with a mask over it. And I think if they're one of the rare people that just simply can't wear a mask because of their other conditions, some people with asthma or very young children, and maybe this person is a great example, like do your best, try to make sure you have like a cloth mask covering or whatever sort of mask you have on hand over it. And if you can't, you can't.
Well, and remembering that the mask is really not in that situation to protect the person, but it's to protect others from what secretions that person has. So the truth is that if you're really short of breath, and there are people with COPD and emphysema, but they just can't wear a mask. You know what? That just is. And that means everybody else around them needs to help protect that person by wearing a mask and trying to maintain 6 feet of distance. Because really you don't want that person to get sick, and they're, if they're going to stay at home and not get out a lot, they're not really at a high risk for getting it unless somebody brings it to them. So I think that's really the important lesson there.
Lauren wants to know about traveling. She wants to do a long weekend away. Is it safer to stay in a hotel or an Airbnb? Are you better off staying in Kansas? Or perhaps a short driving distance location like Iowa or Arkansas?
All right. Well, this will be an interesting question because tomorrow Lee Norman is on our program. Lee is the secretary of KDHE, and part of why he's coming is to help us look at the changes dynamically, not only in Kansas and the Midwest, but across some other states that people like to travel to, where he thinks the next hotspot's going to be. And so we're going to have a long conversation about travel tomorrow. So make sure you tune in tomorrow. You get more of that answered. But Dana, my sense is, you and I have been saying it for a long time, driving's better than flying. Going closer so you don't have to make as many stops is better than anything else. Hotel versus Airbnb, what are your thoughts there?
Yeah, I have a pretty good opinion of that, I think. Having recently stayed in both Airbnbs and hotels, I definitely feel that Airbnb is probably safer. You are not, again, dealing with people coming in, going out in that same building, in the same confines, even though a lot of the hotels have taken a lot of precautions to keep people safe. I think, an Airbnb, you're more in an individual place, so it's just you and your family, whoever you may be traveling with. So in that circumstance, I certainly feel that probably Airbnb is more safe just because you're not around people, even though the hotel industry has gone to great lengths to create a safe environment for its customers.
Yeah, I think that's probably right. It's really, to me, it's about how you're going to get the food. And in Airbnb, you can theoretically make your own food, although in a hotel, you can bring in your own food. Of course, a lot of people when they vacation do the same. But I think it really comes down to that. I think both can be okay as long as you use the pillars of infection control. So it just comes down to that. One more question.
All right. Linda wants to know, are face shields of any benefit for the general public?
Oh, the general public. Okay, Chris, Dana, what do you guys think? Face shields.
That's a tough one.
That is hard. Dana, what do you think?
I absolutely do think that face shields are very important. There was an opinion piece a few weeks ago written by a prominent public health physician, infection prevention physician. The face shields also help to protect you. They are similar to eye protection. We have been an advocate of eye protection, goggles or a face shield. And I think that is one more barrier to help prevent the virus from really coming into contact with your mucous membranes. I actually did see one woman flying with one of the simple plastic face shields that looked like just welder's masks. She actually flew with that. I, certainly applauded her for doing that. But if you can't have eye protection, I definitely feel that face shields do offer one more level of protection against any contact with the virus. So yeah, I would be certainly an advocate of face shield.
That the goggles are helpful, and it kind of depends on the setting you're going to. So, all right, well, let's just go around. Any final thoughts today, Chris?
Oh, I enjoyed the show. Always happy to be here.
Any other words of advice for us?
I just probably want to go back to just speaking to the question in regards to the question about young individuals who are somewhat not willing or having issues or struggling with wearing the necessary face masks, etc. And I just think you really have to think about others. I recognize, young people tend to be healthy, and they tend to be, or think they're invincible rather. That they do get sick, and and COVID across the board does not really discriminate once you enter this hospital. Right. Once you become a patient, it does not matter.
Yeah.
I mean, you're going to be sick.
Courtney, final thoughts today?
I just think from my staff, they mentioned how thankful they were for the general public. There's a great outpouring from all the people around Kansas City to show support for healthcare workers. They're very thankful for that. This is very mentally taxing for them. And so I think just that continual show of support really helps. And Dr. Brown and Ashleigh can probably speak to this. It helps you kind of get through the day, continue taking great care of your patients.
That's very true. I would agree. It's been wonderful to have the support we have had.
Yeah.
Keeps us going, that's for sure. It's been a very stressful few months for everybody, so
Chaplain,
appreciate it.
Thank you, Ashleigh. And so, Chaplain, final thoughts today.
Well, I just want to say that the themes that I've heard surface have to do with self-care and, like going to the gym and what's safe and connection with the people in our lives that are meaningful to us. And those themes, I think, we have to be very attentive to right now. It is very important for us we know this is real now. We've had enough time to see how this affects us as individuals, as a community that works together, and as a community that, lives outside of KU, what is safe and what is going to help us stay balanced and connected. So I just want to say, I think it's important that everyone really finds those ways to take care of themselves and stay connected with those that they love in ways that are safe and meaningful, and to keep kind of that creative spirit going of how we can build those connections and keep them strong during a time when we have stress, both from COVID and then from a lot of other things that are going on in our society and in the world. This is real, and it is a time to really be attentive to how we care for ourselves and our loved ones.
Chaplain, I loved how you phrased what you've been hearing today. I'm going to turn it into one word: yearning. We yearn for the time that has come before us and which is not here today. We yearn for the gym. We yearn for the travel. We yearn for weddings. We yearn and want to return to life as normal. But it's not here. That normal life is not here. But this too shall pass. And the question isn't, do you yearn? It is, when it does pass, will you be here to enjoy it? The pillars of infection control are still with us today, as they are always. And until we're back here with you tomorrow, remember to stay safe out there. And there's still no place like home.